coronavirus pandemic has seemed to put the world on pause. We are learning more about the virus and how it affects us here on the Gulf Coast every day. This morning we have Dr. Adrian DiVittorio with Infirmary Health's Diagnostic and Medical Clinic via Skype to talk about COVID-19 and how we can slow the spread. Good morning.
Good morning.
We are so glad that you're here with us. Our interviews are looking a little different today. So again, thank you for joining us via Skype. Now we want to talk about COVID-19 and what you're seeing in your hospital.
Well, sure. COVID-19 is a serious problem. It is a worldwide pandemic, and it is a virus. It is a respiratory virus that leads to significant respiratory ailments, pneumonia, respiratory failure, and death. So here at the hospital, we have been fortunate in the state of Alabama that we were one of the last states to start seeing a lot of confirmed cases. So we have fortunately been able to prepare. We've had multiple hospital meetings, committees, and we're well prepared with a team of physicians, respiratory therapists, nurses, pharmacists, and other healthcare providers to get in front of this as much as possible. But we are seeing more and more sick patients. We do have patients on life support, mechanical ventilation, and not everybody manifests with the full-blown disease of respiratory failure. A lot of people present with simple cold symptoms.
Right. Now, why do you think we're seeing a rise in cases in Alabama? You know, we just got confirmed a few days ago that we're already over 2,000 confirmed cases in our state.
Well, there's definitely been a surge or a rise in the number of people have tested. So therefore, statistically, we're going to start seeing more and more cases. But certainly the unfortunate thing of most infectious processes, most viral illnesses, whether it be COVID-19, the common cold, or the influenza, is that one person with mild symptoms can infect 4 to 6 people unknowingly. And a lot of people can walk around with absolutely or close to no symptoms of significant illness and pass it on. So when we see propagation of the virus and of the disease, the biggest concern is that people are not taking into consideration the recommendations from healthcare providers and the government as to how to contain this problem, this disease.
And real quickly, what should we do if someone in our home is diagnosed with COVID-19? We know, we're told to stay home for 14 days, but how do we keep that person, safe and healthy in our own homes?
So in general, my personal recommendation, most healthcare providers that have been dealing with the coronavirus is if somebody is diagnosed with the coronavirus, cold and cough-like symptoms, if they don't have significant respiratory difficulties, they're not breathing hard and heavy, and they're not very labored, then yes, staying at home, staying put is the best thing to do. Once you're in the house, you have to self-quarantine yourself. If you're in a household with family members and children, then some sort of accommodation has to be made where you're in a room by yourself, a lot of hand washing and wearing of an aerosolized mask, both from the affected patient or person in the house along with the family members.
And finally, whether that be here in the Gulf Coast, our state, or the world, how do you think we can slow the spread? Definitely, it seems like we should keep on washing our hands, wear our masks if we do go out.
You bet. And social isolation, social distancing has been proven effective. It's not feasible to completely do it. I mean, people have to go to work, to the grocery stores, and all you have to do is look around and see how one person can touch 10 different things, which can in turn continue to spread this. So it is going to be a lot of hand washing, disinfecting, and based on the latest CDC guidelines is if we are in close quarters, then wearing a mask. It doesn't have to be a full N95 mask unless you're directly in the face of a patient that you're taking care of. But for the community and outgoings, and if you're going to the grocery store, then wearing any type of covering mask will help prevent you from infecting other people in particular, not so much you acquiring it, but again, cutting down on the numbers and the disease progression that we're seeing.
Dr. DiVittorio, thank you so much for joining us this morning with that vital information. Again, if you're at home wondering how we can stop the spread, we just learned some good information there. Thank you so much again for joining us on Studio 10, and hopefully we'll all get through this together.
You bet. Thank you.